I'm Dr. Aravinda Ayyagari. I'm a pediatrician, and I've been practicing for about 20 years here in the Wilmington, Delaware area. And I just wanted to go over a question that a lot of people have been asking me, and that is why telemedicine? Why now? And I think that a good way to just approach it is, first of all, why are we doing telemedicine? And for obvious reasons, even before the pandemic, it was available as a great way for patients to get guidance and maybe avoid some urgent cares after hours by consulting with the doctor by video, sometimes by audio. It wasn't really embraced very well by the medical community until recently with the pandemic. So I think that now we're actually quite surprised from a physician standpoint and patient standpoint about how useful it is. I personally have found it useful for talking with my patients more in depth about nutrition, behavior, developmental concerns, things that normally I don't have a lot of time for in the office. I love that I can see the patients in their natural setting, in their house, and they really are very different, especially the kids in their natural setting. So I get to observe them a little bit. I think it's easier to manage multiple kids when they're in their home environment. Siblings, sometimes they get bored in the office setting, and it is hard to focus on just that one child and whatever issues they might have that the mom or dad would like to review. I like going over things with new moms. They need that extra support for their babies and newborn care, so it's nice to have someone to talk to. And a lot of times, you don't need to see really the baby for that visit. It's more the mother, how she's feeding, how she's feeling, how she's being supported. So that's really important for overall well-being of the child. I like using it also for rashes, those quick visits in the office. So you don't have to sit there and schedule and drag the children in just for what is pretty much a straightforward visit. Also to discuss, outside of a sick visit, chronic care. I've got kids with epidermolysis, kids with asthma, ADHD. Parents are actually getting pretty savvy at getting some of the vitals that we need for those visits. And with the asthma, with just chronic management, usually they're not in the middle of an asthma attack at those visits. And it's more maintained, so I can review and really go over how well controlled it is and what they really do with their medicines. And if they know how to use them and techniques, and just to show me online. So I really like that aspect. Another thing that I've noticed is, everybody's having trouble adjusting with the pandemic, and everyone's mood is off, sleep is off. I get to talk to the teens one-on-one. I can have the parents step out to another room, and they really tell me a lot of stuff. And also in that setting, it's great because I can really talk to them uninterrupted. And if I need to screen them for something, I can order some lab work and then follow up with them. I like that I can really talk to them about reviewing labs and symptoms that they're having for, again, chronic issues, or maybe a fasting lipid panel that was quite surprising. So we can pursue that path, see if they need any specialists involved. I like using it for second opinions as well, so to review a case. So that's something I'm looking at in the future. So that's great because you can upload your documents online. I can review them and then we can discuss them, and I can really go over it. Another thing is that I'm doing is nutrition and weight, and just little goals that you can set, and you can tune in and we can go over something and then check back in, so there's not a lot of travel involved. With the obvious dangers with the COVID pandemic, I think that's a great way to keep up with everybody's health and not compromise care, to still make sure that everyone touches base. So that's all the positives that I see. There are some limits to telemedicine. Clearly, I can't listen to lungs. I can't listen to a heart. I can't look in ears. I can't look in throats. So those would be worth more of an office visit. And obviously a physical We can do the talking part online and review some of the habits and things, but it would be definitely worth an office visit to get a full, proper exam. So I'm not going to pretend to think that telemedicine can completely replace an in-person visit, but I feel that especially in pediatrics, a lot of what we do is counseling and guidance and safety and a lot of social aspects of medicine that's more pronounced because you have children involved, and it does depend where they live. It does depend who's their caretaker. It does depend what school they go to. All these things add up. I mean, I typically see patients till about 18 years old. Sometimes some 19-year-olds when we're trying to transition. But honestly, a lot of those issues are more adult at that age. I feel that it's definitely a useful mode, and that combined with office visits is a great adjunct for patient care. I love that this is an option. And another field that I'm slowly getting into is nutrition counseling, especially based on ethnic diets, especially Southeast Asian diets, maybe some Middle Eastern diets. I speak some Spanish, so I'm looking at, Hispanic patients as well, and just communicating better with them and taking more time with them. So that is what I really like. I really enjoy counseling my patients on safety and prevention. That's the name of the game. It's too late by the time you get hurt or, have a chronic issue that could have been managed better. And maybe if you had that rapport with the doctor more often, it could have made the difference. I've noticed that does make a difference if you get the trust of the family and you can really work with them. Another part that I am thinking about is, just having that one-on-one time. And I feel that the families really enjoy the privacy. They can discuss a lot of things without worrying about people in the hallway listening by accident. It's convenient. They can do it from a smartphone. They can do it from a car. As long as they're in the correct state that I'm licensed in, it's not a problem. And now I think that's what my view is. Would love to see some comments or questions. I'm just going to check and see if there's any comments. Or any other thoughts? Well, thank you for tuning in today. I would love to hear your thoughts on this. I'll be posting this to my YouTube channel as well. And I'm Dr. Ayyagari. I'm with RoweDocs, and I'm a pediatrician. Would love to talk with you guys and help you out with your health needs. Thank you.